Aging well, that's the mission of a program looking to help Vermonters while they still live at home. Good evening, everybody. I'm Darren Perrin.
And I'm Kat Villianzoni. But agencies who do that work are short-staffed. Channel 3's Calvin Cutler joins us live from our Montpelier bureau. And Calvin, I know we've reported before on the challenges facing the senior care workforce. How big of an issue are we talking here?
Well, Kat and Darren, Vermont has one of the oldest populations in the U.S., but we have one of the healthiest as well. Now, we have a number of programs that provide care in a number of settings, but some of those programs are short-staffed.
Around 175,000 Vermonters are over age 65. As people age, some will need long-term care, but many won't.
So it isn't inevitable that everyone ends up in a nursing home. I think that's the sort of old misconception.
But they will likely still need some help with daily activities, like picking up groceries and medication, bathing, and house cleaning. That's where Vermont's Choices for Care program comes in. It's funded by Medicare and Medicaid. Right now, it serves around 5,000 people. 46% of them are in their home or someone else's home. 42% are using skilled nursing facilities with care 24/7, and 12% are in residential care or assisted living and receive help with housekeeping, meals, and others. But the program has a problem. There's a shortage of personal care attendants and licensed nursing assistants. The VNAs of Vermont says 1 in 3 positions are vacant.
It's hard work, it's really important work, but it's also never been paid very well.
So as part of a sweeping health care bill this year, lawmakers approved an 8% increase for mental health and designated agencies such as the VNAs of Vermont. But Mazza Olson says that funding is just meeting 3 years of increased staffing and inflation costs.
Home health and hospice has really been investing in wages, in retention bonuses, in sign-on bonuses, and then of course gas prices have skyrocketed.
Mazza Olson is also worried about a proposed 6% cut in Medicare home health on the federal level. That decision is due in the fall. But a broader solution to our workforce woes is in the works. Big investments in our healthcare and workforce sector, $10 million for scholarship and loan repayment programs, and employer grants to train existing staff to provide home health and personal care. But leaders say caring for people as they age is just one piece of the equation. Smith Jang says the state also focuses on prevention, dealing with diabetes, heart disease, or arthritis to help people live independently longer.
So yes, we're going to need a robust workforce. Yes, we're going to need to really look at staffing in long-term care facilities, but it's much bigger than that.
That bigger picture will lie in an action plan to support seniors over the next decade. Vermont's Action Plan on Aging Well will lay down a blueprint of how government can house, feed, and accommodate an aging population. That plan is due next summer.
Now, ultimately, leaders say Vermonters of all ages should have the conversation of what it means to age well and how to deal with finances, transportation, housing, and mobility. Your local area on aging can help start some of those discussions. Reporting live in Montpelier, Calvin Cutler, Channel 3 News.